Okay, guys, thanks for coming to the Edenic Round Table videocast. We're talking all things health today, all things healthcare. Very prevalent subject right now, and something that everybody's looking at. I'm really pleased to have a virtual roundtable with us today, so I'd like to welcome everyone here. And I think just for ease, it's probably easier if you guys just say who you are, where you're from, where your relevance is to health, just for people watching so they can understand who's talking about what. I'll start with you, Darren.
Yeah, hi. Thanks, Wayne. So I'm Darren Crombie. I'm the founder of a company called Upstream Health. We're based over in Hull on the Humber, and we're looking at how do we use technology innovation, such as devices in the homes of elderly people, to help keep them well and for longer in the places they want to be. And really, right now, there's a lot going on in the COVID space. We've just won the IT Health COVID Awards in terms of what we're doing. So it's really interesting to talk today about what else is going on across the region.
Excellent. Sounds really cool. Pete, over to you.
Hi, thank you, Wayne. Yeah, I'm Pete Waddingham. I work for the Yorkshire Humber Academic Health Science Network. I'm a programme manager across there. For those that don't know, the Academic Health Science Networks, there's 15 of them up and down the country, and we try and find and spread innovation amongst the NHS in a very kind of simple strapline. So that's me.
Awesome. Thanks, Pete. And Chris?
Hi, everyone. I'm Nhs Mckee. I'm a Business Development and Innovation Manager at the Leeds Teaching Hospital Trust. Also have a visiting research fellow contract with the University of Leeds. My role really is to engage with all things innovation and industry and try and bridge that gap between academics, clinicians and the industry sector to try and bring new and novel solutions into the NHS to improve health and well-being for all, really.
Thanks, Chris. Thanks, everyone. Well, I mean, innovation is the word that's going to be coming up quite a lot today. I mean, it's the buzzword of the time, I suppose, but a very relevant time, and particularly in healthcare. But before we get into it, I'd be really interested just to get your guys' views just on what the state of healthcare is now, in just speaking for the UK in terms of the NHS or the healthcare sector as a whole. You know, do we feel it's behind the times? Is it struggling with innovation? Is it in need of major reform, or are we doing okay? Where do you feel from your point of view? Chris, I'll start with you.
That's fine. I can go, yeah. So I think NHS-wise, I think it's safe to say the NHS is behind the curve when it comes to innovation, and it has been that way for a long time. I think matters of routine practice, funding issues, etc., has resulted in that kind of culture. That being said, in the past few years, there's been a lot more talk about how do we innovate. And the one good thing, if there is one, that's come out of COVID is it's got people rethinking about how we do things and thinking that we really need to change practice. We need to rapidly adjust. We need to look at the new existing technology out there. How am I going to see my patients if they can't even come into the hospital? I've got patients who need chemotherapy who I've not seen for 2 months. These kinds of things. So that's my view on it. Is in a nutshell, is we're moving into the times where people are ready for it and they're hungry for it.
Yeah.
So it's time for change, and I think a lot of people are aligned with that.
Yeah. Of course, the long-term plan for the government that they've released as well is to start looking at sort of preventative or self-care and preventative health, and staying healthy and looking after ourselves, which is all wonderful. Matt Hancock's going on about it just about every day of the week, which is, I suppose, an eminently sensible approach. But how is the NHS going to adjust to that in terms of, because it's traditionally it's a reactive service?
Yeah.
Right. Yeah.
For me, it's going to be case by case basis, and it's going to be based on the funding that can come into it. The new hospital builds that have been announced, the 6 of them that have been officially signed off from the government, are going to be a good way of doing that. It provides this sort of a new, fresh start platform to bring innovation into the heart of it. And in Leeds, we've got 2 new hospitals coming by 2025, with almost an innovation village, innovation hub being built around it. We've got a system in place called the Leeds Way, which has got innovation at the heart of it. But a lot of it's going to be, selective on, who do we work with, who's got the right tech, who can we develop that tech with to get it to fit for purpose and address the unmet needs of the community. But we'll be looking at funding streams across the board: NIHR, Innovate UK, internal funding pots if we can get them. I think we need to tap into all of this to get it to work. And obviously AHSNs are then here very much so to support that and move it to adoption.
This is it. If I can kind of I was just mentioning really briefly some work that's been recently done on health and wealth and economic growth, and we were just talking briefly, weren't we, about how you need to think about the environment and tying that in to health. And I saw a really good infographic today that just showed the links between, you know, global warming, increased flooding, and actually the detrimental impacts on health. So, you know, if we do want people to be healthier and that preventative side of things, we've got to look at this kind of whole picture. You know, because I might be sat at home eating everything really well and exercising, but actually there's a kind of global situation going on as well. You know, air pollution, which a bit like what Chris has just said, you know, we need to think about the positives that have come out of COVID, maybe less cars on the road. I mean, that was always an article that was in the news that there was maybe less pollution. So definitely good things that have come out of COVID and a real appetite, I think, for change. But I think prevention can't just be about health. It's got to be about the wider picture. It absolutely can't just sit with a health kind of label.
And I think, Pete, what you said there is really key, that actually there's good come from COVID. And actually, when we look at innovation, we can see some of that good. So, you know, I've come from a healthcare tech background now, 15 years, smashing my head against the wall with a lot of others for the first 5, 10 years as we went through things. For those that don't know, back in the kind of 2000s, through national programs for IT, stuff that cost the taxpayer a lot of money and actually didn't change our clinicians' lives or patient outcomes. And lately, you know, the last 4 or 5 years, there's been a lot more support from AHSNs, from innovation organisations to help us get products into trials and then start to take them out there. And they've not really grown across the board. But as soon as COVID hit, it changed, right? So we had, you know, in Humber, we had nurses that, you know, hadn't wanted to do video consultation stuff with their clients, wanted to be face-to-face, really saw the strength in that. And then within 1 week, we put in 500 nurses onto our platform just in 1 week, you know, to see 1,000 patients the following week through video consultation. And, you know, it wasn't really a shock, but the response was the nurses liked it, the patients liked it because they're not traveling, and actually they've got more time to talk because they're not moving around to all of the spaces they need to be. And that's really important when you've got a place like, you know, in Humber, we've got a big region, lots of rural people, and it takes a long time to travel around, you know, and there's better things to do with your time. Yeah,
absolutely. No, good example, that.
Yeah, I mean, and I also think there's a lot of regional inequalities in terms of access and the quality of care we've got. And the NHS, of course, is huge and massively fragmented. So does this make it harder as an innovator to try and push boundaries in there, or interact with it, or get involved with it, or change the thinking of the organisation?
Yeah, it's a good question. I would say now is a better time for innovators, but then it comes down to what you have to offer, because everyone and their grandmother now is getting on the COVID bandwagon. I think it's fair to say, and there will be a filtering process. A lot of this is how does this tie into what we need now? What's the urgent public health need? Etc. etc. There's great platforms coming out there for like IVD medtech, in vitro diagnostic medtech companies called Condor, which is now live as an example of something that innovators can really tap into. You know, rapid clinical assessments and, you know, health economic evaluation of in vitro diagnostic medtech to get it there, get it straight into the NHS for the fight against COVID. It's not just diagnostics; it's serological solutions. But then if you're not in kind of the buzzwords at the moment, maybe it is a bit harder. But that's why for me it's about keeping the conversation going, stimulating. We want to go to our clinicians and say, guys, what are you missing? You know, what is your unmet need? Create a shopping list that innovators can then tap into. So there's ways of doing this, but you need that proper R&I infrastructure behind trust to get it to work.
I think there's also a cultural issue across the board when to really in my house, to do innovation well, you need to make sure that you are comfortable with failing, and that kind of fail fast mentality. And that's definitely not easy for people. People want kind of ready-made, it will work, we'll implement it, and if it failed, actually, we'll really get annoyed that it failed and we shouldn't have done that. You've got to really be comfortable with rapid change, and because look at COVID. I mean, we're hearing every day how like the science is changing and keeping up. So you've got to adapt at pace, really, haven't you? So the solution that we might have created today that was innovative might not be the right solution tomorrow. And I think that's, there's a cultural thing. It's not easy for people to do, to accept.
Yeah. I mean, from my perspective, what I'd love to see is a bit more variety in the innovation we see as well. So, we often see, I'm not saying that doctors are bad, right? But we see a lot of tech startups started up by doctors, really smart guys, but they're focusing on how do we look after really sick people. And actually, we're about Upstream, and what a lot of people are trying to move towards is say, actually, your social care worker, your nurse, your bin man, to be honest, they're the people that might spot those early issues and help with prevention. And maybe if we had, bin men coming together, to help build some innovative solutions, we'd be able to actually make a bigger impact than just focusing on doctors.
Yeah, of course, Darren, and they're coming, the doctors, for example, that are setting up these health startups, they're coming from very, I suppose, traditional backgrounds in that they're very well educated. They've spent a lot of money in becoming doctors and a lot of time in training. I suppose they don't really want to be challenged to some extent. And so they're creating stuff based on what they think they know from their own expertise to one side.
I think the key thing is, if you're a doctor, your job's to treat sick patients.
Yeah.
That's
so
the
think
whole
reactively.
By the point they get to you, they're sick, right? And that's your problem.
Exactly. Yeah.
You're not trying to stop them ever getting to you in the first place.
Yeah. I think that's a challenge. It's definitely a challenge to the industry, I think. But also from a private sector point of view, I mean, when we talk about healthcare, particularly in the UK, because we're obviously very fortunate to have an NHS, and a lot of countries don't have this kind of access to healthcare. So we're very lucky on that front. But then on the flip side of that, we naturally link everything to that. And of course, now the private sector, the innovators are kind of going alone to some extent and not trying to integrate with the NHS or whatever, and creating their own preventative platforms or self-care platforms, or trying to disrupt the industry from their own point of view. Now, can that be troubling for public health to some extent because they're going to get left behind? Is that a risk?
I think what you've just touched on there, that kind of market-driven, kind of consumerism is something that I'm really keen on. So what you're suggesting is that people get frustrated, they'll go off and do their own thing. Yeah. But actually, in the commercial world, that's what separates the great from those that get left behind. So, for example, and again, like to pick Amazon as one success story that I think most people are comfortable with, they are a commercial organization, they do things well, people buy into it, they use it, and then they can expand. And I think the problem sometimes with health is that there is still a bit of a reliance that it's free and that it should be free. And I was giving this some thought yesterday when I was looking at technology for things like virtual reality. Now I'm about to buy a virtual reality set for my PlayStation. Wouldn't it be great if I knew that headset could integrate with a health system so that I could, watch what was happening, interact with care? So it's not like health have to pay and buy that product for me.
No.
But it can integrate. And I think if we could get to that world where people would put their hand in their own pocket to complement the health system, I think it would have a massive improvement. I think it would create economic kind of growth for people. But unfortunately, there is still that mindset that the health system has to provide for us. And I understand that, I get it. I think it's right for certain situations, but I don't think you should, underestimate there are willing people out there that would put their hand in their own pocket.
I mean, I've always felt, and I think I've said multiple times, that the NHS is wonderful, but it shouldn't be something that we rely on. It should be something that we work with. It's a luxury to have when we really need to have it. But that doesn't mean that, therefore, we shouldn't take care of ourselves and just hope that they'll pick up the pieces at the end of it. We have a responsibility to work with the system. And I think changing that, but also I think people do want to do that. I think people are actually quite interested in their own health, but to some extent is you have to put it in front of them and provide it and make it part of their everyday cultural way of living. I suppose if they have to go too out of their way to do that, then it's like anything, it becomes a challenge. So I suppose it's treating patients like consumers to some extent. You've got to think what makes it easy for them and what makes it accessible for them.
I think one of the interesting, I guess, dichotomies of that is that, you know, there's lots of people and people have every gadget and gizmo out there, you know, that you can buy to keep yourself well, to keep an eye on yourself and, you know, keep you engaged in your own health. And so people are buying preventative solutions, and then the disengaged, the people that actually aren't really looking after themselves, they're the ones that ultimately are going into the NHS and resorting in the highest costs. So, you know, if there was a way to, you know, incentivize, you know, free preventative solutions, and maybe actually desensitize the high cost stuff. So if you don't look after yourself, you're penalised.
Yeah,
that for me would be the better solution. With all this, it's hard not to exclude.
It's a contentious one, though, isn't it? I mean, that immediately raises so many sides of the argument, so to speak, you know, because as Chris says, you know, there is this expectation that, you know, we're all, you know, we're taxpayers and we pay for this health system and it's there to look after us, etc. But where does the balance lie? Because you can lean so heavily into, well, you owe us, you must provide, rather than sort of how can we help you? And interestingly, the COVID thing seems to have spun that a little bit in terms of the volunteering and the way that people are thinking about it. I mean, how does it appear to you guys now? Has there been a change in culture, do you think, as a result of the pandemic?
Yes. Yeah, I definitely think so. I think it's been quite a positive one, and you have seen sort of different people in the population come out of the woodworks. I think people understand just how much the NHS does do for them. You know, the word hero is being used a lot for not just healthcare workers, but you know, across the board for key workers. So I think that there is a newfound respect there, which is shared by the majority of people. But there's still a long way to go. And you know, you're talking there about how do we engage the community that doesn't care about its health. And there's other factors there, obviously, about inequalities in pay, for example. So there's poorer people are less likely to be able to afford the solutions that make them better, and et cetera, et cetera. And there are companies out there really trying to understand. A bit of a shout out here to a company called Scaled Insights, for example, who look at behavioral profiling of people from a health perspective to say, you know, who are we really dealing with here? Who are you? You know, are you someone who is going to want to adhere to your medicine or engage with technology? Or are you someone who's very reserved about that, or maybe even aggressive towards it? And it's really has to be looked at from that basis. And it's the same with how have people responded to the NHS during this time. You've got these clusters of people.
That you know, linking to your question, Wayne, about prevention, what Chris has just mentioned there, data now is you know, if there was ever a kind of silver bullet that could help with this prevention, you know, agenda and get things, it's understanding early so that you can change things. I know that's you're a massive fan of it, aren't you, Darren? And again, when we talk about data, one of the issues that we're still maybe not fully bottomed out is making that data accessible in the cloud, so so it is accessible, because without that you can't join it up, knit it together, apply the whole host of things like machine learning, artificial intelligence on it. But data has to be one of the positive enablers that we've got right now.
And I think it's just looking at how do you, like, you know, is that it's kind of superhero saying, you know, with great power becomes great responsibility, and it's that with data, with great data, there's a responsibility to do something with it. And actually that's scary for health organizations, because once you've got data, you've got accountability to do something with that data. So really we need strategies on how do we build out data sets that can be actionable, so that actually with the data we can drive some insight and we can do something with it. And that's the bit that really is going to be quite cool, I think, over the next few years, to see how organizations like startups can then help service organizations like the NHS or even private organizations really change the service delivery models to prevention.
Is the hierarchy of the NHS to some extent, so the people that I mean, going all the way up to government, I suppose, the people that are making these decisions, are they somewhat shielded from this, though, really, about what the capabilities are out there in terms of, you've touched upon AI and machine learning and understanding data, but do they understand it, or are they just choosing not to act upon it?
I think they do. I think the reason I say that with a degree of confidence is you've got great organisations in health like NHS Digital and now NHSX, and within NHSX you've got people focusing on artificial intelligence and an AI laboratory. So, and Chris, you know, be well aware of a range of other organisations that are all kind of helping this agenda. I think it is well known.
Yeah.
It's the pace at what that change can happen. That mindset is still a little bit slow with a lot of people, but this is why we keep saying COVID helped that, because actually in an emergency you must start making quick decisions, and I think a lot of people want to kind of hold on to, how did we make quick decisions in COVID? How do we make sure that we still make quick decisions post COVID? And you know, so I'm fairly confident people do know that this is there.
And just to, I guess, the other side of that, Pete, just, you know, I think there's been some nervousness in the public sector about reliance on big private organisations, you know, on the Apples, on the Googles, on the Androids. And actually, if you looked at the contact tracing app as an example, you know, that had failure all over it from the start. And anybody that works in health tech knew that that wasn't going to work, you know, that it wouldn't have been widely used. You couldn't drive people and force people to use that. Therefore, the only way to have made that work would have been to go with Apple and Google from the start, but they didn't, you know, and then they switched around when it was probably too late. So I think, but that's driven from that nervousness, which I understand, right? That these big organisations, the Facebooks, you know, can they be trusted with our information? You know.
Yeah, you're completely right, Darren, and I think it's a bit of a shame, because in some ways, but you know, we're looking at GDPR compliance here and safety for patient data records and governance issues. But NHS Digital, you know, its headquarters up in Yorkshire, it's in Leeds. They have kind of given the green light on some of these guys. AWS and Google, the cloud, is an accepted platform for people to build their AI and health tech solutions into. And if we find out that you're using that as a cloud, working with us in our trust and other trusts, it's a good sign for us. We say, actually, we're pretty confident that you're safe and secure here. And it's a bit of a shame, really, that they've had to almost go full circle with that again, because people have already come to the right conclusion with it a few years ago, to be honest.
Talk about those massive organizations as well. So your Apples, your Googles, your Amazons, etc. I mean, they're part of our culture now, aren't they? They're part of our everyday lives in literally everything that we do. So to some extent, we have to accept that they're inevitably going to have to play some form of role, probably in our healthcare. It's going to drift, well, it already is drifting over, but I mean, probably more so. So it'd be interesting to see what you guys think about how the private sector and the public sector complement each other. I mean, Pete, you're kind of making those links. That's essentially what your role is. Darren, you're working from a private point of view to try and help from a health point of view. So where's the, you know, is there always going to be a fear, or do we have to kind of get rid of that and accept that the two need to be working as one? And trust as well, build that trust in those big organizations, as you say, because it's inevitable.
I mean, I just had a conversation this week about AI, and there was a key strategic leader who kind of said, look, don't be frightened that you'll always have spectrums of thought, people that are risk averse and those that are real opportunistic. And actually, I was kind of sort of dwelling on that this week and pondering on it, and I think, yeah, you'll never find a situation with innovation where everyone's all bought into it. Sometimes that then requires good, strong leaders to take the decision, you know, based on the advice, based on the evidence, and you know, you want to bring people along with you, and that's the ultimate goal. But sometimes as well, you need strong leadership. But I guess the point is, I don't think there'll ever not be a time where you don't get difference of opinion and people being a bit sort of risk averse of, well, that's the private sector. I don't think there's anything to be worried about. But as Chris said, actually, when you kind of dig under it, and if you really hand it on a plate to people in simplistic terms, you know, when you think about data and you look at AWS and it's got, I don't know, got like military grade encryption on it, you know, really people should feel quite assured that their data is probably, you know, well, is very safe. And again, I was thinking about artificial intelligence this morning as I was walking the dog, and there's a real ethical thing about it at the moment. And a lot of work goes into that, make sure people are comfortable that machines are like looking at your data.
Yeah.
And I thought, well, but when have I ever questioned, like when I've had a blood test sent off, that a piece of equipment's analysed my blood? You know, it's a piece of machinery that's looked at it. It's not a human that's done it. So why should I start now getting worried about AI? But because we've kind of almost started like cementing in our head potentially this sci-fi thought of AI, robots, it becomes a problem that maybe it doesn't need to be. And then that problem is what holds back the innovation.
Yeah, I mean, it sounds like it's almost a contradiction, isn't it? Because as I say, if you go back to those big players, we're supplying our information just about everything about us pretty much every single day, from the moment we wake up to the moment we go to sleep. And even whilst we're sleeping, we're pretty much giving out this data. But yeah, when you start equating that to smart intelligence, using that data to advance something or do something, then all of a sudden it feels like almost like there's some kind of violation going on or abuse of it. And I suppose, I mean, that's a cultural shift though, isn't it? I mean, is that an education thing?
Yes.
Yeah. I think if you looked at any organisation and you spoke to the people in the organisation, most people just want to do good.
Yeah.
And you whether you work in the NHS, whether you work for Amazon or Microsoft, you come to work and you generally want to do a good thing. And if you work in the health sector, you probably want to do a good thing to help people stay well.
Yeah.
I think it does get scary, you know, when like you say, you look at Amazon. You looked at my purchasing history, you'd know that I'm trying to stop my hair falling out. You probably know, how often I'm exercising based on what I'm buying, and maybe even how often I'm having sex. So it's a lot of stuff on there that they can then use to then target you. But it doesn't mean they're going to. It doesn't, just because there's an Alexa in every room, doesn't mean they're always listening.
Yeah.
So I think it's just
I think I'm comfortable with it as long as there's a bit of a kind of a vision of where it's going. So I mean, again, we touched briefly before in the early conversations about environmental sustainability. I mean, I'm desperate to see a green, healthy planet. Yeah. But I think that technology is unfortunately the only thing that's ever going to be able to help us to get there, because it'll help us understand the science, the numbers that are too big for us to comprehend. It'll help us come up with the solutions. And even daft things like today, I was reading an article about, cloud-based data. It's causing a massive environmental impact. So we all think we're doing good, sat here having a video conference, not traveling, yet the energy that's going into video consultations is actually quite big. I mean, again, don't quote me on this, but video consultations, when they looked at them, was like the size of a few different countries. I mean, Spain was mentioned. The environmental impact of just video consultations was equivalent to a country's actual carbon footprint. However, if you cloud-based with an environmentally green supplier, that goes away. So, we need to kind of always have I guess what I'm saying is we should always have our eye on that vision, that ball of what it is we're trying to do, like a healthier planet, healthier people. Not technology for technology's sake.
Well, I suppose it's what you don't know, you don't see, so to speak. I mean, so it's like data centers and stuff. I mean, most people probably have very little comprehension of really the scale of a data center or what it involves. And, when they're on a video call or whatever, or on Facebook or whatever, they forget that that's all feeding through an infrastructure somewhere in a country, in a desert somewhere, or whatever it might be. We was looking at stuff in the Humber just recently about looking at putting data centers in the Humber and looking at cooled data centers using the river to cook, and then taking the energy that comes off that to heat businesses or homes or whatever it might be. And so there are solutions, and people are looking at this stuff, but I'm not sure it's big enough or wide enough to start making an impact. And there needs to be more of that. Going back to that earlier buzzword, innovation, we really do need to just be throwing stuff out and trying it to discover if it's going to make a difference. Because we can talk loads about it and look at lots and lots of data, can't we? But we need pioneers just to be building stuff and throwing it out and seeing if it works.
The money with it to go with it.
Love or hate Elon Musk, right? But he could, looking back in time, he could be a person that saved more people's lives from respiratory disorders than every respiratory consultant in the UK through what they're trying to do. Yeah.
I think you're absolutely right. Yeah, I mean, the man said years ago he was going to go to space, and he went to space, and who'd have thought? So I mean, regardless of what your sort of personal, whatever the tie is, it's people that are trying to do stuff, and I think we need more and more of that. And I think there are players in there. There are lots of companies that are all trying to develop and try new ideas. sometimes it's frustrating because they don't really get access to the resources or maybe the funding or whatever it might be to kind of get stuff out. And sometimes sorry, go on.
I was just going to interrupt, sorry, because again, this is, you know, what you're kind of alluding to as well is something that sits with me quite a lot. You've got all of these great people out there, but we're maybe not cross-pollinating enough as well. And again, there's a report that I've just read recently that said we should all look to try and have almost like secondments into each other's organisations, big institutions. And I looked at that and I thought that's such a great recommendation to really kind of work collaboratively. It might even be that you don't even have to have a secondment, but you use office space of a totally unrelated office. You know, so I'm a health worker, let's say, but I don't have to go and remotely work or sit in a hot desk in a health institution. I could go and sit in a corporate, you know, entity or something. And that cross kind of collaboration might just help massively.
Yeah, you're completely right, Pete. I mean, apart from the fact that I want to log off now because I feel really bad. But you're right, and I think that's exactly the point. Is the solution might not be in your field. For example, AI imaging. There's other areas that have been doing that for years for different engineering purposes. They might be better at it. They might have something to share. There's, you need to tap into, fintech, envirotech, health tech. It all needs to cross over, because sometimes people just reinvent the wheel because they just don't think about, well, actually, is putting a camera down a very thin pipe any different to putting it down your thin pipe? It's sort of, it's true though. It is. And Chris, what we're starting to think about.
Yeah, just last night. So I was thinking about this, like in terms of startups generally want to work with other startups and partners and small organizations, and we want to collaborate and do stuff together. Whereas the big organizations don't always see it that way, right? And last night I was watching the news and I was quite naive, right? So I know the biggest challenge we've got right now for coronavirus is how do we get a vaccine, right? That's the biggest challenge across the globe, right? We've got 150 vaccines globally being produced by independent, separate teams that aren't speaking with each other. So last night, when the headline came on the news that the Russians had come over and tried to steal some technology from the UK in different areas to then support them with what their pioneering guys are doing in terms of vaccine development, I just thought it was mental that we're not already sharing that information. Why do we have 150 organizations working separately to fix the same problem that's killing all of us? We can't get it right there with these big organizations and at government levels. Then, where do we take the inspiration from?
I had an interesting conversation with my granddad about this. He's very pro-British, very, Empire Days kind of discussion. Completely links to what you're saying, Darren. And what the end conclusion was is he likes to talk about everything we're doing. What's Britain doing? These drugs we're developing. What's the vaccines we have? And at the end of it, his thought process is, I hope he doesn't listen to this, but his thought process is, we can sell it. It's a business. It's like once we've developed it and we own it, and we've patented it, we can sell it to everyone else and we can profit from it. And that doesn't really align with what we should be doing, but that thought process is there in the background. And that's the competition. It's the race to who can do it first, who can get the gold medal, and who's probably going to get some profitability out of it. And it's a sad reality, really, that we are competing in that kind of environment where really we should make it, produce it, and give it to everyone to stop us dying on a global scale.
Yeah, I think there's a tie in there as well. I mean, you've touched upon it with politics, I suppose, but also media. I mean, so Darren, you'll watch a news report that says, essentially the Russians are trying to spy on us and that, which of course has that knock-on effect where everyone goes, well, this is what happens with your data, and everyone starts panicking about, it being intercepted and all that. So the media, I guess, have a role to play in that. And then, of course, in terms of what's going on politically around the world, we've seen various world leaders all reacting to COVID, for example, a pandemic, quite differently, and probably all for their own reasons or political reasons or whatever it might be. And so it's strange, because then I agree, you almost need that kind of utopia global thinking, don't you? When you talk about the population, if you're talking about the human race and something that's affecting us, then you'd think as one unit, we would all work as one to try and address the matter. But there's so many things that are jagged in between those decisions, aren't they? And that might be consumerism, that might be political, that might be economic, or whatever it might be. And I suppose that's always going to be a challenge for addressing global issues, isn't it? Particularly in health.
Yeah.
I guess the only kind of flip side, again, going back to those global players about the data, is that data knows no geographical boundaries, does it? You know, Facebook is across the globe. So, and obviously countries can regulate. I mean, I think we've seen with it, was it China or someone wanted the banning of TikTok and stuff like that. So obviously states can intervene and kick things out, but technically we've got a lot of things. There's companies, I guess is what I'm saying, who have got access to a lot of people's information, and I think, you know, trying to put more of that information into the system is, I think, a good thing. But we must, as I said, try and look at artificial intelligence, become comfortable with that it's not here to destroy us, and that actually, as I said, it's already here anyway. So let's not kind of overplay it. Machines are already doing things for us. So I think, because if we don't do that, I guess the reason I'm saying that is that we might be another 5-10 years away from being able to achieve the things that we could already do today. And again, Chris knows this far better than I do, but I know Israel are quite health tech ahead, aren't they? You know,
Yes.
And
yeah.
You know, there's countries out there that are already doing the things that we kind of want to be doing.
Yes. Yeah, completely agree, Pete. And I think there's loads of good stuff coming out of the UK. There's no doubt about that. But there are other parts of the world that are doing things differently that we can learn from. Israel's a really good example of that. One of their main, financial resource is actually through innovation and startups. They don't have a large amount of agriculture. Their trade is their ability to create. It's around intelligence, which is why you have so many startups coming from people from military engineering backgrounds or military intelligence.
Yeah.
They're proud to show you as well. You know, they give you the CV and it's like, oh, this guy was a spy, I think, but now he's got his own startup. It's a different way of thinking, and we can find it if we're willing to open our minds a bit and work together and just get past, a few of those boundaries, theoretical boundaries, really. You like the idea, you have the conversation, and then go from there. That's how to innovate, really. It's just chat.
So who's going to be who are going to be the big players in the healthcare sector then? What does the next 2 to say 5 years look like? Is there any, obviously there's the famous names that we all know that are all dabbling in that world, but have you seen stuff out there that you think is going to, or a company or a particular service out there that's going to really dominate, you think that's going to be a key disruptor? Throw everyone on the spot a little bit there. Darren, your company, right?
Yeah, well, maybe with others though, right? So I think there's plenty of, the big name is in the UK is obviously Babylon.
Yeah.
Right, in terms of what they're disrupting and how they're trying to change the market. They've had, a lot of investment, like a crazy amount of investment into that organisation. I guess 1,000 times more investment than we'll have over the next year. But they started to get some traction, both in the UK and then actually when they were struggling maybe down south to move abroad as well, and they're getting traction there. So I think there are people that are disrupting the market. I'd like to see though, people like Richard Howell's Tribe project, a project that's about, linking volunteers, identifying gaps in the population where they need support, then linking them to volunteers. Really platforms like that change stuff rather than the traditional stuff that we may focus on.
Yeah.
Interesting.
I mean, I've got Chris. Sorry, you go, Chris.
Thank you, Pete. No, I think it's a bit of a tricky question. It's a bit of a setup question, Wayne, because if I mention, if I mention one company, then the others will get upset with me. But the truth is, I think it's not really down to any one company to solve all of the solutions. I think what we will see, and you may disagree with me, but what we will see coming out of this are sort of branded platform systems. A really good example of this, another shout out really would be the Northern Pathology Imaging Cooperative, which is digitized pathology and brought digital pathology into everyone's minds. And it's a platform through which companies can embed themselves into. If I had to put it in a very, very brief words, it would be plug in, plug out kind of thing. Solution comes in, and then something else comes out better. put something else in, pull the other one out. And I think that's probably the right way to do it. It's what big, far-reaching platform systems can companies embed themselves into and share in that big piece of pie, because no one's going to have the all-round solution for everything.
I mean, my crystal ball analysis would be, again, I think the data, going back to the data, if every hospital trust and every GP trust and every community service in the country, because we talk about the NHS, but I think most people should understand that it's not it's not one entity, unfortunately, it's a series of lots of things. If we could bring all that together to say, actually, that data is the NHS's data, that would go a massive way, so that people don't have to get involved in sort of, well, I've got this bit of data from there, but I can't get access to that. It needs to be the NHS's data. And then obviously you can apply things like AI on top of that. That'd be fantastic. Yeah. I think the other area that, Sam, I mean, so we sit on a lot of power, we sit on a lot of data to the NHS, and we need to harness that and maximize that, and then let innovators tap into that. I think the other area that interests me is a little bit as well is like gaming. You realize how big gaming is if you've got kind of young children, or even if you're into it yourself. And the technology that comes out with gaming and how it can be applied to help health, I think still a bit undertapped and is interesting. Everything, as I say, from virtual reality, augmented reality, and even just the touch, the things that you can start doing. I think that will be big in the next kind of 5 years if we learn from the gaming industry. So if PS4, PlayStation, Sony want to give me a job to come and get us a comment, I'm I'll happily do that.
Again, it's that cross-sector stuff, isn't it? As you say, you know, there's stuff going on in other industries and we need to cross over. And I agree in terms of things like climate and environment, that's going to play such a vast role in just everybody's health, you know, because everything around that is a knock-on effect to health ultimately. And so there has to be a really big focus on that. And of course, the big topic was really climate change, you know, sort of before COVID kind of came in. That was the big thing everyone was shouting about. And then of course, everything stopped. And of course, we've got to keep ramping. Oh God, I nearly said ramping up then. That was a government line. Sorry. We've got to keep pushing that message, that climate message, because that is really going to, all the innovation that comes out of that addresses that ultimately knocks onto the health side of things, doesn't it? You know, in physical health, in mental health, in environmental health, in everything that we do. And suppose so looking at that industry and what we're doing to challenge that is definitely going to be, I think, is going to have a future impact as to what the health system does. A couple of things I want to touch. I'm just really aware of time, gents, and we could go on for this forever. So I'm just going to quickly shift, because a couple of things I wanted to touch upon with you guys to get your thoughts on it. One was the fragmentation in healthcare between physical health, mental health, and social care. For me, I think for most people, they're not massively connected, or they appear to be very much fragmented, and really they should be working as one. I think most would agree. What's stopping that, or what can be done to address that? I know that's a big topic, but from your point of view.
Wow. Okay.
Well, how do you link it? I mean, firstly, do you think it should be linked?
I don't think it's as big a problem as you think, and I think making massive inroads. And again, just to talk about data, but sharing of information, absolutely fundamental, and it is happening already, and it's making good progress. I saw a great article this week, a video about what they were doing to join up end of life care records between all the different agencies. It'll have a massive impact to people's, you know, final stages of life and the compassionate care. If we can join data, it's not an issue, I don't think. I don't think you'll see that fragmentation. When we can't join data and share records, fragmentation. I don't know if Darren, if you would echo that, or...
I think there's definitely the data piece and the network piece have come on. So, you know, we've got AHSN now, so it's Health and Social Care Network. So, you know, it's interesting to you like your gaming, because, you know, the PSN was the main network for the public side. But so I think on the technology side and the data side, things are coming together. I think that actually, though, a lot of the time, you know, the teams weren't working together anyway, regardless of technology. You know, you can pick up a phone and ring somebody up and have a chat about how a patient's doing when they've left hospital, if you know who to call. You know, if your social care team know who your post-discharge manager is in the hospital, and know who the consultant was that's being treated, if you actually just have a chat with each other, you can probably look after people better. And what I've seen just from, you know, my days when I was looking after a community services on the NHS was that we were governed quite differently. So, you know, we had our remit, what we did in community care. the social care teams had another remit and a different boss, and then the hospitals had their own agenda, and the CCG were in the mix somewhere as well. And we weren't all singing from the same hymn sheet. At team level, we kind of wanted to get on, but actually at a management level, there's lots of politics and governance in terms of how we fund our services that kind of stops us doing what we wanted to do. That said, I think a lot of that's changing, right? So with Manchester especially, we've seen a lot of that coming together. In Hull, we're seeing that change. In Leeds, we're bringing budgets together. Once that's sorted out, then we can look at how we integrate teams more effectively. And then hopefully all the stuff we've been doing on the data side and the technology side is all going to be there for the teams ready to go.
Yeah. How do you see it from an NHS point of view, Chris? I mean, do you see that? Do you see that fragmentation, or do you think agree it's really not as severe as it seems, and actually it's just more of a communication thing?
Yeah, I think it's a hard one to say when you're not directly in the clinic. But you're right. Yeah, I mean, I think communication is a key part of it. I do think it is fragmented, but not in a way that we need to panic about it. Yeah. Almost like pretty much what Pete's saying, but with a slight bit more caution, I suppose. But community is the key word for it. And I think the NHS struggles a little bit, but definitely getting better at its patient and public involvement and kind of stuff, and reaching out to, it's you said it before, really, education sort of platforms. Really hoping, really, with the new hospital builds, based on discussions we're having, that it's a place for people to kind of to come to if they need to engage with the healthcare community a bit more and be a bit more open about it. To have a place where you've got you've got your hospitals there, but then you've also got a cinema next door and stuff like that. And so you don't just have to be in hospital on a bed. You can go somewhere to get out of that headspace. It all forms part of it. So yeah, it's just one of those things where we need to open it up more. I think we need to address that is there. It is an issue, not just for the people like ourselves in the community, but also for the staff on the ward, who also have to deal with this on a daily basis, and just provide them, get just places they can retreat to, almost, safety zones. I don't want to say safe space. It's not the right phrase, but just somewhere they can switch off. And that's where the NHS needs to go. Otherwise,
I suppose it's kind of like, for me, it'd be like kind of a GP prescribing this kind of stuff away. I mean, again, this goes back to that cultural thinking and the way that we're taught, you have this problem, this is the thing that fixes it, and off you go kind of thing, as opposed to almost predicting some of the stuff that might be coming up either mentally or physically, based on your lifestyle or experiences you've had, and then being aware of the solutions or the things that are actually out there away from medicine and the traditional pharma route, that you might be able to push patients towards, to try and help them self-change, the situation that they're in, as opposed to curing it. I mean, it comes back to that, presumably.
I like what Chris said, though. Again, I mean, you gave the example of the cinema, but you're absolutely right. Why isn't the gym, the football pitch, whatever it might be, really closely integrated with the healthcare system, the hospital, whatever it might be? So they actually, and the environmental side of it. I mean, I've seen some very small examples of great green hospitals, everything from, greening the roofs and creating habitat on site. It has a massive effect on people's mental health. When you arrive to hospital and you're anxious, that can have a knock-on effect for a whole range of reasons. If you arrive at hospital and subconsciously, there's some greenery and some beds, and some nature and some colour, your brain won't even know what it's doing. It'll be calming. I'm not saying it will totally ease your anxiety. Depends what you're going to hospital for, but it could just make that little bit of difference. I love that idea of a community type model. I think that's fantastic.
I think just to add as well, I think we should be optimistic about what we're doing in the UK, really optimistic. So, I went to China. I was lucky enough to go out on a trade mission a few months ago and went around their health system. And actually there's some stuff to do really well, but it's all in silos. So it's all, actually, they don't really have community care like we do. It's not that way. If you're sick, you go into a hospital. There's not a primary care function. So we've got this great organisations in our country already, and actually we're doing some cool stuff. So, you know, one of the things I'm proud to be based in Hull for is that we've got the Jean Bishop Integrated Care Centre, and that shows how things can be. That you've got frail patients come in, meeting with social care resources, meeting with community resources from different organisations, meeting with GPs, getting physio, getting rehabilitation, meeting with fire services. So it's super cool stuff, and getting a free lunch, you know. And there's a nice green outdoor space as well they can go and sit out in. So yeah, I think we've seen change, and it's going to be really cool the next few years to see where that goes.
I think what's cool about the UK as well is, I agree, Darren. We are a community spirit. We're a community country in the way that we live. Our culture suggests that, and so the links between environment or entertainment or health or food or whatever it might be, we do cross over all the time. I suppose it's kind of making that official, or putting in official positions to it, so that everyone knows that they can push into that direction. I suppose we naturally do it. As you say, the Jean Bishop Centre is a great example of lots of things coming together to make a great environment. And I suppose if we can make that part of our lives, our healthcare lifestyle, I suppose, then that can only be a positive. I do wonder as well, in terms of, do we need to look at anything around enforcement? And that sounds really like a harsh word, but like in terms of the things that we're able to do now, I'm thinking of things like, having microbiomes and things like that, Chet, the 23andMe thing and stuff like that, where you can sort of almost predict what you're likely to be suffering with later in life. Is that something actually that we should all do as part of our natural self-care process?
See, this is where what I said earlier on about people will put their hand in their own pocket for things. I think the job for health is to show people what to put their hand in their pocket for. Yeah. Because a lot of things out there that are not fit for purpose maybe lead you down a path that's not the right one. And I think, tapping into the education and the intelligence that health has of all the clinicians, and then making people want to do it. I don't think it needs enforcement. I'm certainly not an enforcement fan. I want people to want to do it. Yeah. I think that's the key, make it socially acceptable that people want to do it. And again, it's not really like an exact example, but a lot of people are on Facebook because they know their friends are on Facebook. So it's a socially normal thing to be doing. Even though, how many times do people criticize, like teenagers, or look at them, are all on the phone? Yeah, we're all on that phone criticizing teachers, but it's a socially normal thing to do. So, yeah, I'm not a fan of enforcement.
Maybe encouragement, maybe. I suppose, again, it's the ease, isn't it? It's education. I suppose I agree. It's making people aware of what is possible. And by you doing this, it makes our job easier. And together we can do something better. I suppose that would be more of the message I would be pushing.
I think, enforcement's a really strong word, but there are instances where, outside of places like China, you look at like Australia, and it is a requirement to get checkups for moles just to ensure that you're not at risk of getting melanoma. There's a very high risk of it, and that is actually, I believe, you have to do that. And you could look at that as a type of enforcement for the betterment of people. And I think it is the wrong word. It's the wrong way to do it. People will brush up against that. We're having a very controversial, shouldn't be controversial, but very controversial moment now where there's the mask argument. Really good example of that. And simply put, from my perspective, from the healthcare background and everything, that we should be wearing masks. But you've got people in Parliament, and I don't want this to be a political thing, but you've got people coming up and saying, I don't want to wear masks, it looks stupid, or I'd rather die than wear a mask, all this stuff. And that's where leadership, at least, is need to say, this really is for the betterment of the community. You've just got to do it, and we will have to crack down a bit on that, because it's not about you, it's about everyone else.
What about
incentivizing?
Incentivizing. I mean, again, to think your example of Australia, but wouldn't it be great when you mentioned that you went to go and get your mole checked up, you got free cinema tickets in the hospital that was next to the cinema? You just mentioned, incentivification would be great.
I agree.
Yeah. And again, and that makes that cultural shit. You know, for me, it always comes down to culture. Everything we talk about, whether it's in health or environment or not dropping your litter or drinking less or whatever it is we're trying to get people to do, it's a cultural thing. And a lot of people make a reference back to really silly things like the seatbelt. You know, it wasn't, doesn't seem that long ago that, you know, you weren't enforced, that word again, enforced to wear a seatbelt, and it was a cultural shift that you had to make. And now, of course, it would be weird to get in a car and not put a seatbelt on, because not really even because of the law, but because it feels wrong not to do that. And it's that shift, isn't it? And I suppose again, that has to come from multiple facets, which again is education. It's coming from directly from the health sector, you know, so from your GP or whatever it might be. It's coming from your workplace, it's coming from your community, it's coming from the sports teams. I mean, again, it comes down to that everyday lifestyle community thing, isn't it? And it's connecting that together more and more, which I think is going to have the wider impact.
It just comes down to how many people are going to jump on board, you know, with anything. You know, it's just, you know, now most of us are going to go into the shops and we're going to be wearing face masks because we think it's the right thing to do. Some won't, and I don't expect the police to do anything about that. And I guess it's the same with lots of things through COVID and through life. I got one of the tests to do my antibody test, and I filled it in and did it. You know, but a lot of people chose not to bother because maybe they didn't think it's valuable to them. And that's not saying they're wrong and I'm right. It's just that's where their mindset and their culture was.
Yeah, one in 3 people, even if there is a vaccine, you know, they don't want to have it. And that's the latest statistics that I was told. Even if we have one, 33% of the population, based on surveys, just won't take it. So there's a trust thing there, isn't there? It's sort of, you know, we do know, sometimes we know what we're talking about. We do make mistakes, we're human, but you know, we're not saying to wear masks to make you look silly or to have a nanny state thing or anything like that. It's sort of, you know, it really is to try and get through this because everyone's suffering with it. And the vaccine thing is a whole other debate, and I really hope I don't get loads of hate mail after this. But it's
it's all right. Not that many people will see it anyway. Don't. But there's no. You're absolutely right. And I mean, you know, for me, and it's that situation. You know, when you're at home screaming at the TV when you see something on the news or something, because it just seems so logical. And like for me, something like a face mask, for example, just seems. Everything in me says that's very logical. If I cover my mouth, I'm unlikely to release a spray or a droplet or whatever it might be, and therefore I'm less likely to infect someone else, and that's how we kind of contain it. Everything logical in me says that. Of course, everyone will have their own opinion on that. Yeah, what if I'm deaf? What if I'm asthmatic? What if, you know, it's against my religious beliefs? What if it's this? What if it's that? Everyone's got their own pot. But sometimes there's the greater good, isn't there? And again, that's hard. I wouldn't say that. I mean, the UK, I don't think is particularly a selfish nation. I think we're generally a selfless nation, and we generally try and work together wherever we can.
Well, let's take that mask example, and in terms of what we've been saying about innovation and joining up. We've got a prime example here of something that's not green and environmentally sustainable, largely. So we're not talking to the right sectors to get that. We're not creating many in this country, so we're not creating economic growth. So that's one of these things where, yes, it's a small mass that's got a kind of health reason behind it, but we need to think with that wider lens so that actually people get behind wanting to wear the masks, because it creates economic growth in the region. It's not damaging the environment. You know, some of the big, you know, if we tie the kind of things together in a logical way, we bring a lot more people on board with us, I think.
Yeah. And I agree. And I think coming from the other angle as well, Pete, I mean, if we go back to like the environment thing and the stuff that the waterline campaign that's happening here in the Humber. Now, obviously that campaign is really set up to decarbonize. Ultimately, we're looking at a zero carbon economy. That's what we're trying to do. Now, a lot of people simply just don't care about that because they're not seeing the direct impact of it until your house is flooded or whatever. It's kind of out of sight, out of mind, you know, unfortunately. However, if you can spin that and say, but it will create this many more jobs, it will create this type of attraction or this type of tourism or whatever it might be, then almost it becomes a benefit to me, so to speak. So sometimes you've got to look at it from a different angle. And the same applies to healthcare, I think. Okay, I'm going to wrap up, guys, but just moving forward, just how, as a general one-liner from each of you, how do we think the health system looks moving forward? Are we on the right track? As COVID helped the pandemic highlight a lot of gaps that are being addressed, you know, does it look positive?
From my perspective, yes. I think we've got a lot of catching up to do, and that also includes elective surgeries and actual procedures themselves. But we're moving in the right direction, and I think the future is positive. People are thinking differently now, and it's good.
Thank you, Chris. Pete, what about yourself?
I don't go. Yeah, I'm an optimist. I think largely anyway. I think if we can set a good vision of what we want health to look like, with all the things that we've discussed, I think it's so important. A 10-year, 15-year, 20-year vision, whatever it might be, we need it, and then we've got a goal to work to, and we just need it to be painted out so people can visually imagine it.
Yeah. Darren?
Yeah, well, I'm an optimist like Pete, and I think, you know, in the next 10 years we're going to see, you know, the same amount of change in health technology as we've seen in the last 100, you know, since we set off down this path. So I think it's going to be a really cool time, and actually I think that UK are going to lead the way. So yeah.
No, it's a really positive view, and I completely agree. I think we're seeing exponential change in technology. The rise of our knowledge of what we can do with technologies is so quick. It's rising so vastly. And I think our capabilities in even 5-10 years from now are really going to be game changers in what we come up with. So, and I also agree, Darren, that I think the UK are certainly pioneers or one of the key leaders in the world for some of this stuff. And it's great to see so many businesses that are actively trying to address these problems and use the technology to address these things, which is going to be for the greater good for all round, I think. Gentlemen, thank you very much. I really appreciate it. I appreciate you taking the time to come on. This has been really, really interesting. I think you could break down any one of them topics and talk about each of them for hours, probably, if you wanted to. But hopefully it gives a good flavour of what our perspective, at least, of what the healthcare system is looking like and what the future looks like. And we all have a role to play, I think, is the ultimate message that comes out of it. And innovation is good. So get behind it, try stuff, and get involved, because it's going to be really positive. Okay, guys, thanks very much. Appreciate your time. Thank you. Cheers.
Thank you very much. Cheers. Bye.